Hi, I'm Dr. Rajan Segar from the University of California, Los Angeles. The question in front of us today is it important to proactively screen for connective tissue disease-related PH? In short, the answer is yes. Let me show you some data. The issue is that patients who have systemic sclerosis and other types of connective tissue disease are at risk for developing pulmonary hypertension. And the issue is, of course, the mortality associated with this is quite significant. And this first slide shows that the median survival of patients in the pre-treatment era, so prior to the development of pulmonary hypertension-specific therapies, in patients who had systemic sclerosis with PH was approximately 1 to 2 years, compared to relatively preserved survival in systemic sclerosis patients without pulmonary hypertension. So it is certainly a predictor of increased mortality and thus needs to be screened and screened heavily. In terms of why is screening necessary, the diagnosis of pulmonary arterial hypertension should always be entertained in the patients with systemic sclerosis and other autoimmune diseases. The earlier the diagnosis is determined would prompt earlier therapy and pH-specific therapy, and this may and has been shown to actually alter the natural history of the pulmonary arterial hypertension phenotype. And by introducing therapies sooner, and screening patients sooner, we may pick up patients with earlier functional class limitations. So instead of picking up patients with functional class 3 and 4 symptoms, which is typical in systemic sclerosis-related PAH, we hope to shift that to pick up patients with earlier functional class limitations, such as functional class 1 and 2. And there is evidence to suggest that if we do so, we may alter the natural history and thus the mortality associated with this very mortal condition. So with that, I think we can end, and thank you for being part of this discussion.